Have you ever seen a patient wearing a football helmet in the hospital? Chances are, unless you have worked in an ICU or a critical care setting, you probably have not encountered this, but let me explain it. This patient has a Blakemore drain in, and what a Blakemore drain is, it is a drain that can be placed by a provider for patients that are having extreme bleeding from varices. There are a couple different versions of these strains, but the concept is pretty similar behind all of them. There will be a big balloon. Sometimes there's just a balloon that's inflated in the stomach. Sometimes there's a balloon in the stomach and in the esophagus. And these balloons are filled up in order to create pressure or tension against the esophageal wall as well as stomach wall to kind of compress those bleeding varices and hopefully stop the bleeding. You can also hook the end up to suction so that way you can be suctioning out contents at the same time. The reason we attach it to a football helmet is to create this tension on the end of the tube so that way the balloon in the stomach and in the esophagus is kind of pulling up, creating more tension against the walls. You don't have to put it to a helmet. You can put it to some sort of tension. You can tie it up, but there does need to be some sort of weight or tension against the end of this so that way you can apply the tension down where the balloons are. I've only seen these a handful of times. These are usually like a last ditch effort, like we've tried everything that we can, but this patient is just massively bleeding and like this is our only option. So I have never seen one of these patients actually do well. I'm curious if you have actually seen one of these patients survive this because typically these patients are massively bleeding. And that's that. Let me know if you have any questions.